All right. Hi, my name is Billy Partita. I'm a student nurse. I've checked the order and doctor has ordered an NG tube for the patient today as he has some nausea and vomiting to release the pressure in his stomach. So I'm going to knock on the door, wash my hands, provide privacy to the patient, introduce myself. Hi Bob, my name is Billy Partita and I'm your student nurse today. The doctor's ordered you an NG tube to be inserted. You've been having some nausea and vomiting, so to release the pressure in your stomach for the contents, we're going to insert that tube for you today. Can you verify your name and date of birth? And he says Bob Owens, 9/22/1933. Okay, Bob. I looked in the order of the chart, and it's Bob Owens, 9/22/1933 for the NG tube. The doctor's ordered on low intermediate suction. So once he comes back and I've placed the NG tube, then we will attach the suction for the patient. Okay? So Bob, I'm going to explain the procedure to you. What I'll be doing is I'll be inserting this NG tube from your nose into your stomach. Do you have any troubles with swallowing?
No.
Okay, that's good. So it'll go into your nose, into your stomach, alright? So the first thing that I'm going to do is check your nose for any obstruction in your mouth. I don't see anything. I'm going to have you breathe out of your left nostril for me. I feel breath, and now breathe out of your right nostril, and I feel breath. Okay. So for the procedure, we're going to have you in the high semi-followed position that I have you in. This is going to prevent from any aspiration. We want to prevent any aspiration into your lungs, okay? I'm also going to check your gag reflex. Okay, good. I do see that you have a gag reflex, so we're good there. So I'm going to measure first. Wash my hands. I'm going to provide you this protector. This will keep you clean, your gown from getting dirty during the procedure. I'm going to provide this basin just in case you have some nausea and vomiting during the procedure. First, we're going to measure. We need to measure from the end of the tube, from the tip of your nose to the end, back of your ear, and then from the back of your ear to the xiphoid process. I see the number here is 60, but I'm going to tape it to be sure we do not insert it any further than what is needed. Okay. All right, good. So I'm going to wash my hands. I have gotten all my supplies here. I'm going to put on my gloves. I have my tape ready for the tube after we insert the tube into your nose. We're going to put the tube into the gel for easier insertion. Okay, so Bob, when I'm doing this, I need to have you hyperextend your neck, and then I'm going to insert into your nose until I see through the oropharynx. I'm going to have you take a couple sips of water, keep breathing for me. And as I advance the tube, I want you to swallow, okay? I'm going to advance it 5 to 10 centimeters, making sure I don't feel any resistance. And if I felt resistance, we'd pull out the tube and then try the other nostril. If we can't get it in, we have to take you down to have it placed. But you're doing really good. Take a couple more sips. Can you put your head down? And I'm going to insert it all the way. 5 to 10 centimeters, slowly for the patient to prevent too much gagging. Keep holding the tube till you get to where you have taped it. Don't let go of the tube. Now you want to take the piece of tape that you've prepared to hold the tube in place. Oh man, it is sticky. So put on your skin prep. Want to be careful. If it was an elderly person, use different tape for them. Put the tape around the tube like this. Don't let go. Around the nose to keep in place. So if this was a child, you would put it through the mouth, or a baby, you put it through the mouth. But since it's an adult, we put it through the nose. So then I'm going to measure from the end of the tape to the end of the tube. Okay, I have 24.5, so that I will note that in my chart when I go back to make sure it doesn't move. Keep track of that so that it doesn't move. So how are you doing, Bob? He says good. So now I'm going to prepare a piece of tape so we can just keep this piece of tape to secure the tube to his gown. Until you come back from X-ray to check the placement of the tube. Okay, so we have the pH sticks here to check the acidity in the stomach. That is also checking placement of the tube. It needs to be 5.5 or less. That tells us that we're in the stomach, or per protocol at your procedure, what you would do is put this in here, take out some gastric contents, and then check the pH. You also could check how much is coming out for the patient. Okay, so now we sent you down for placement. They stated that it is placed correctly. So I'm going to put your suction on for you. You look like you're doing good. Is that correct?
Yeah.
I don't see any aspiration, no distress of breathing. All right, so I can take off my gloves. I'm going to get rid of all of my supplies. And then I would put you into the normal position. Okay, and I'm going to give you your call light. Everything's going okay, Bob?
Yes.
Okay, and he says yes. So you want to check, like we said, for aspiration or any respiratory distress. But it looks like Bob is doing good with his NG tube so far. And that's it.